Everyone is an ally in the journey towards eliminating cervical cancer and increasing the uptake of the HPV vaccine.
Young girls are going to have a chance to, avoid the horrors of cervical cancer.
HPV vaccine is not a very common vaccine in our population, and also there could be a lot of misinformation about that, which I already hear that there is, because and as soon as it is linked to, say, sexually transmitted diseases or so on, people kind of really become very rigid and not accepting easily.
I think very few people really know what HPV vaccine is. They know they should take it and that is something to take, but for what, to prevent what, and what are the real consequences of not taking it, I think are poorly understood amongst the youth.
How do you increase acceptance for the vaccine using new approaches? Now the approach here is, let's build on the benefits of social influence.
The side effects of this vaccine, won't it cause sterility? Won't it make the woman infertile and things like that? So these are sort of some of the misinformation we need to dispel. We need to dispel from the beginning.
And I think when we're talking about HPV, we're speaking to a young demographic that is a rational actor who's able to engage in conversation.
So we need an integrated approach that this kind of programs related to HPV vaccine and other vaccine should be included in routine immunization. We need to have youth-friendly services optimization. Or in my context, it's already there, but we need to optimize it to let youth-friendly services be optimized at every level of healthcare facility.
We need the political leadership to say, this is not just a health thing, it's not just a health issue, it's also an educational issue.
We have had the experience. Now, definitely challenges would be there, but again, it's the job of the concerned stakeholder that starts from the ministry itself and involving all the national stakeholders and coming down to how we communicate.
Using youth advocates is powerful because they can relate more to a younger person who comes from a similar background to them, speaks their language, and is able to make them feel comfortable about conversations about their body, conversations about how HPV is spread, conversations about the need to protect yourself from that in future.
We also need to have a different mindset with the policymakers, and especially for funding, not only for the vaccine, but also for the health communication and the demand creation. We also need to tell the story of HPV vaccine from a different perspective, looking holistically at a lens of 360, so that we bring all players on the board.
Provide the political support, provide the funding to the immunization program so that they can roll out the vaccines and sustain and maintain the vaccines.